everyone, welcome to join the webinar today. I'm the host HS. The topic is how to use the Advantech iHospital solution to support the work to do the infection prevention and control to fighting the coronavirus. Okay, and begin the topic today. I would like to share what is the finding about how to get ready to fighting the coronavirus. First one, we know the hospital is a very important organization, so we need to develop things to make sure we can help the patient and all the staff in hospital is safe and have the good distance and communications. Okay, so first of all, we would like to share how to use the new process with the technology and new processing and the training. Okay, so we'll go for that with the solution one by one. So as you know, Advantech had a lot of the solution already built in the hospital. But now it's a new virus coming, so we need to take a new one. But we still focus on this process. But we need to go out the new space to make sure the patient and the hospital staff can be isolated and working safely. Okay, so first we were talking on the outpatient and the IWAR and with the RTLS technology. So all the detail will come from our new PM Edison and Jackson to go through detail in the next session. Okay, so let's welcome the first speaker, Edison. Welcome, Edison.
Hello everyone, I'm Edison, the product manager from iHospital SRP team. Today I would like to share with you the Advantech hospital queuing management solution and how this solution can help effective control management for outpatient epidemic prevention. Situation and challenges of COVID-19 for hospitals. The current situation regarding COVID-19 poses challenges for many countries. Governments around the world have asked people to practice social distancing and avoid going to crowded places. For the hospital, a large number of patients flow into hospital for treatment. At the same time, it also increases the risk of virus infection. The question is, how can healthcare service provider provide a safer environment for patients and staff, which also deliver an excellent service for all? There are 3 guidelines to reduce the risk of infection during the outpatient service. First, practice social distance and always keep 2 meters when queuing. Second, avoid congested areas. We must control the waiting numbers in waiting area. And third, reduce physical contact. Avoid touching kiosk and using a contactless process instead. For the above 6 reasons, the hospital needs a comprehensive solution. I think Advantech's outpatient queuing solution can help. Before I talk about how the hospital queuing solution can help to epidemic prevention, I want to give all of you a general understanding of the solutions. As you can see, the entire solution consists of many industry apps like queuing management, outpatient management, and digital signage management. And the HSRP solution ready package includes the interactive queuing terminal, self-checking terminal, and queuing display terminal. When the patient walks into the hospital, the self-service kiosk offers multiple functions such as ticket dispensing or check-in. And medical staff can adjust the calling order according to the waiting number. Outside the clinic room, patients can do self-checking by themselves. Nursing staff can know the patient status from the calling apps and call patients according to the priority rules. And public signage displays the real-time queuing status and guides the patient flow. All of the data generated during the patient journey will be completely recorded, and the visual data report will be provided through WisePass dashboard. And for IT management, we provide centralized remote management, hardware monitoring, and software upgrade function. But we need more effective control methods for epidemic prevention before patient entering the hospital. And virtual queue in patient journey. Virtual queuing is a practice where patients don't have to physically wait in line to get a service, so they have minimal close interactive with interaction. Managing patient flow in the control area. Based on the epidemic prevention experiences of Taiwan, the hospital will set up a control area and quarantine the patient. First of all, to confirm whether the patient is suspected of having COVID-19 symptoms. If not, the patient can enter the outpatient area directly. If so, the patient needs to enter the control area and put on a RFID blacklist for identification and access control purposes. Medical staff can use the medical-grade tablets with calling apps to call patients and controls the queue of examination. When the patient is called, the medical staff use the tablet to scan the patient's scan the QR code on the patient's bracelet to verify the patient's ID or for check-in. According to the progress of the calling number displayed on the digital signage, the queue transfer with a single number for each laboratory counter or room. No need to get a new ticket. And after complete all examinations, the doctor diagnoses and make medical advice whether the patient needs to be admitted to a negative pressure isolation ward or go back home for self-isolation for 14 days. The queuing solution can help medical staff to manage patient flow in the control area, and the quality can be conducted in an orderly manner and avoid the risk of infection of the hospital. Hospital queuing management, the system architecture diagram. As you can see, here is the system architecture of hospital queuing management, also known as HQM. The solution is composed of signage, CMS, and hospital and queuing engine software from the server side, and includes a queuing control app and digital signage player from the edge. For the IT department, the queuing engine software and signage CMS software need to be installed on a server, and we provide centralized remote management, hardware monitoring, and software upgrade function for control center to do system maintenance. For the queuing management installation side, we support signage players with Windows and Android OS. It can be connected via a network cable and output display from HDMI. The queuing control app is installed on the tablet and connected to the server using a wireless network. So medical staff can do mobile management, making the application more flexible. The solution has no extra integration required and allows hospitals to quick build up entire solution. And now I want to talk about the software deployment and explain how HQM works with signage CMS software. And here you can see the signage CMS server offers content management functions, and the queuing engine server is used for queuing information management. All of the HSRP is pre-installed, the Sandy CMS client and queuing client. And they all connected to the server side. First, the designer can edit the program content on the Sandy CMS server and dispatch those programs to each client device. And please see the blue line. And second, then setting the queuing line information on the queuing engine server and apply the configuration to each queuing client. Then third, when the customer gets the queuing ticket and waiting to be served. Then fourth, the counter staff can control the queue by the counter call app. As you can see, just a few steps can make the software ready to serve. And optimize the patient journey. As I mentioned, the patient flow controlling of the hospital is very important. Implementing a queuing solution can improve the efficiency of administrative services, and the most important is to optimize patient journey. That enable patients to confirm the attendance from a kiosk or remotely from their phone, and save the queue of people waiting for staff to tell them where they need to be. Reduce the demands on administrative staff. Enable staff to focus on providing a better quality of patient care. And here is an example. Miss A and Mr. B, they get fever, and they are going to a hospital for taking examinations. Now see the Mr. B. The hospital without the queuing solution. The patient needs to need to face some problems. The first, undetermined waiting time, and frequently ask medical staff during the consultation, and stay in the same waiting areas with other patients. That also increase the risk of infection. And medical staff cannot effectively control the number of patients, so that will cause the waiting area crowded. And now see the Mr. A, the hospital with the Advantech hospital queuing management solution. The benefits are significant, and they could go to other places without worry, and also save the patient's waiting time and increase the hospital visit efficiency. And first, the most important is it can reduce the virus spread in hospital and protect patient and staff from infection risk, and ensure the safety for everyone. Thank you.
Hello everyone, I'm Jackson Xu, product manager of iWar. Today we are talking about the infection control and the prevention with iWar solutions. So let's take a look here. The most important thing is we want to reduce the risk of infection, and we want the infection to be under control. So two topics is very important: communication and location. Let's take a look at iWar. Here in iWar we mainly have four major iApps. One, the first is the iWar Control Center. Second, the patient care management. Third, nursing station dashboard. The fourth, the patient call engine. iWar Control Center is iWar server. It's a core of iWar provide service for all clients. The patient care management solution include bedside information terminal and patient information terminal, nursing mobiles as a name, which provide service and information for patients. Just a simple click, patient can send a request to nursing staffs. As the nursing station dashboard include dashboard and control center, and the central dashboard, which can help nursing staffs to gain information quickly and clearly.
The last one, the patient call engine, provide communication function for patients and nursing staffs. Besides, I will provide API allow you to develop and integrate with third-party apps easily, like the RTLS or FRC system. Okay, through a nursing call solution, we can help nurses establish communication with the patients in the hospital, provide safe, fast, convenience, and high-quality calls. In this way, patient and nurse can exchange a message in real time, improve the efficiency of the cares, also avoid excess contact with the isolated patients. Let's take a look at nursing call solution architecture here. It's very easy, and it's easy to installation. You can see just install a patient call SIP server, then the server will provide service for all the nursing call client apps. We support the Android base, we support the Windows base, so we can install the nursing call apps on the cell phone or the bedside or patient information terminal. It's very safe because it's in internal use only, and it's very security and stable and very fast. Not just nursing call solutions. In addition, our solution can be advanced imported. The patient information terminal and the control station. The patient information terminal mainly provides service and information to the patients, that the patients know the treatment plan, the medicine he take, and medical team, and other informations. It also provides a function allow the patient to feedback their needs just through a single click. It's very simple. The control station function let nursing staffs to grasp the word information and shift information, and set reminder for the patient information terminal, and also to know the patient needs very easy and RTLS information. As you see, the iWard not just improve the efficiency of the nursing staffs, and also provide convenience for the patients and protect the caregivers to protect caregivers not to have too much contact with the isolated patients. Let's take a look at RTLS function here. The real-time locating system, we can use it to the patient control. What function it provides? Let's take a look here. It provides the real-time locating information and the tag list, the area control, and the low power warning and the low power consumption. It's very easy to implement. RTLS, real-time locating system, we can use on the patient control. Take a look here, refer to the following process. When the patient is found to have a fever and need to be isolated, okay, he can wear RTLS bracelet for him, then bring to the isolation ward. Through the RTLS system, you can know the patient's path and the location and the patient list in the time. You can also make area control alarmed. Means the isolated patient cannot go anywhere. They have to stay in the isolated area. That means if he try to escape, the system alarm will warn you too late. Okay, somebody's trying to get out, so you must be warned. You must be careful about it. So provide more information and protection for the nursing staffs. Of course, RTLS not only use on patient control. We can use to positioning the equipment, important materials, and we can see through the simple installation, the tag is placed on the equipment which needs to be located. The RTLS system can know the position, path, and list of these equipments in time. Especially some equipment in hospitals is quite expensive and need to be regulated. It is even possible for the nursing staff to wear RTLS bracelet. So the RTLS system can know whom may be using the equipment and their location. That's a conclusion here. Yes. So the nursing call solution, we can bring a real-time communication for the nursing staffs, and avoid too much contact and reduce the chance of infection. And our solutions will bring more information for patients and nursing staffs. Yes, for patients, we provide helpful information for them and request easily and conveniently. And medical staffs, they know the patient's request immediately. And overview of the beds and the patient's information and reduce the chance of infection. And RTLS, of course, we can use on patient control and equipment locating, so we can real-time know the location and know the path, and we can protect the medical steps and escape the warning. So let's get it now. Okay, let's take a look here. We compare with the Miss B and Miss A and Mr. B. We can see the Mr. B without the solutions, what will happen? He don't know the treatment plan, so he don't know how we'll do the treatment at the next. And without nursing care, so they don't have the communication function, so the nursing steps may increase the risk of infections. And without RTLS, so he don't know where he is. So if you need immediate help, they can find you. Now, okay, let's take a look at Miss A. Okay, so he know his treatment plan because he have the IWA solutions, and he has nursing code, so he can build in communication with the nursing steps, so he can immediately request his needs very soon and very easy. And with the RTLS system, so he can track in his location, so he can get help immediately and very easy. Okay, today is our IWA solutions. Thanks everyone. I'm Jackson.
Thanks the speaker Edison and Jackson. I believe they are present a lot of information and technology and the solution to help you to build a safety hospital. So if you have more questions, and you can contact the email listed in the video, and we will respond as soon as possible, help you. And as you see, the Taiwan can help for healthy and to take care of the thing, not only the hospital but also your life. Thank you very much.